And let's talk about health real quick, because when it comes to joint discomfort, whether it's you or someone you care about, you have solutions available. On behalf of our sponsors at the Regenerative Orthopedic Center, our Nicole DaCosta is taking us out to their Tualatin location to learn about hip and knee replacements.
Dr. Jim Ballard and Dr. Chris Nanson are both board-certified orthopedic surgeons specializing in hip and knee replacement surgery in private practice together at Regenerative Orthopedic Center. And together, these two surgeons were the first to perform outpatient hip and knee replacements in the Pacific Northwest. I am so happy to be out here at your beautiful new Tualatin location and excited to learn about all that you do in the practice. Thanks for having me out.
It's great to be here.
Thank you for having us.
Yeah, have you noticed, why is everyone getting hip and knee replacements? It seems like it's a topic these days.
It's a collision of a couple of factors, and so everybody hears about the demographic boom, and so you've got the baby boomers that are hitting age 65 and up. The average age for a hip or knee replacement is about 66 or 67 years old, and so obviously we've got the largest generation to hit this age ever in the history of our country hitting that, and so that's one thing. The other thing is that we have a younger demographic, so patients that are in their 40s and even some patients as young as in their 30s that are benefiting from advances in sports medicine, orthopedic surgery, reconstructing injured joints, and so those patients are coming through. But with the advances in surgical technology and surgical technique that we do in our outpatient hip and knee replacements, we're able to offer good reconstructive options for even younger patients that are going to be long-lasting 25, 30 plus year implants. So it's not, you can't have it because you're too young. So that's a kind of an individualized patient discussion for them, but we've got both of those factors converging to really produce a demand for these surgeries.
Now, how young is too young to have a hip replacement?
Hip and knee replacement, that's a question we get all the time in our office. People have this, unfortunately, this preset expectation that if you're not 65 or 70, you can't have a joint replacement. And while that kind of used to be true with all the reasons that Chris talked about, that's changing a lot. When you get younger, below 50 or so, it does become a very specific discussion with your surgeon, but we really believe in the individual patient. So people that have terrible arthritis in their 40s, if they can't move, that means they can't go to work, they can't be with their children, it becomes a mental health thing, it becomes a social issue, they can't support their families, well, they need their joint replaced. So now that discussion is open to people that are younger, and we've even operated on people in their 20s. Your youngest?
Yeah, my youngest has been 21.
Right, because that person needed it, right? And it changes their life, so.
One of the most fun visits in my office is the 6-week post-op check. So, you've gotten to, a hip is feeling 80, 90% better, a knee is, probably 60, 70% better from the surgery. The patients are happy, they're not having a lot of pain in the day, they're sleeping through the night, they're finally realizing that they can do things that they haven't been able to do in years. And you get this realization of, wow, why did I wait so long to get the surgery done? And it's, but that waiting period was important, for them to kind of get to the point where they needed this surgery. But you can really, it can become a life-changing surgery for patients, which is why we're fortunate to be able to do what we do.
Absolutely, and I'm sure folks at home are curious, how long do, new joints last?
So that's an interesting question too. What would you say to that?
So I give kind of a standard line of 25 to 30 years. Okay. And I think with new technology, I think that's very reasonable. The stuff we put in the 90s, the knees lasted pretty regularly 17 to 25 years. The hips would run about 20 to 25 years.
Okay.
Hip replacements, I think it could be a lifetime replacement for people with about a 93% confidence, somewhere in that range. Knees, probably 85%, it could be a lifetime. It's heavily dependent on who puts it in, the techniques that are used, etc. But people have every reason to expect it's going to last a long time.
Right, absolutely. And folks at home, ROCPDX.com is the website. Strength, mobility, function, life, they're going to help you out. We really appreciate you having me out this morning.
Yeah, thanks for coming over.
Thank you so much.
On behalf of our sponsors at the Regenerative Orthopedic Center, thanks for this important info today. It's great to know options are available so we can all live more comfortably. And visit ROCPDX.com for more information.